Hello everyone, welcome back to my channel, a channel about health, nutrition, and my study abroad life in the US. Today I want to share with you my rotations at WIC as a dietetic intern. If you don't know what is a dietetic intern yet, please check out my channels about how to become a registered dietitian. Basically, the dietetic internship is a stepping stone for us to be qualified to take the RD exam and become a registered dietitian. If you are interested about my other rotations, don't forget to check out these videos where I talk about my clinical rotations at a hospital and this video where I talk about my food service and management rotation. But today, I will share with you guys how a day in life as a dietetic intern working at an outpatient setting, community nutrition at WIC look like. At the end of the video, my manager at WIC will share some advice to the further dietetic intern, so make sure you stay to the end. Before I share my experience, let me give you some background information about WIC. WIC stands for Women, Infant, Child. It is a non-profit organization funded by the USDA. WIC provides federal grants to low-income pregnant, breastfeeding, non-breastfeeding postpartum women, infants, and children up to 5 years old who are in nutritional risk. The federal grants can be used to buy fresh produce at your grocery stores as well as formula for formula-feed babies. After telling you a little bit about WIC backgrounds, let me share with you guys my experience as an intern at WIC. As a dietetic intern, our main role is to do nutrition counseling for our clients. When I talk about clients, I meant what I mentioned earlier, the pregnant women's postpartum breastfeeding, non-breastfeeding women's, infants, and children up to 5 years old. Therefore, you really need to master your nutrition requirements for these populations. I remember for the first 1 to 2 weeks, I was mainly shadowing different counselors when they see different clients. So I have a little chart that I need to mark completed after I see each category. After I completed all these categories of shadowing, I can then start my own counseling sessions with the clients. WIC is also actively promoting breastfeeding. Therefore, we have breastfeeding consultant there to teach moms the way, the position of breastfeeding, and the benefits of breastfeeding. This is also what interns need to learn and teach about. On top of these, WIC also has daily classes. The classes are actually mandatory to the parents because they need to finish the class before they can get the check or the money from WIC. However, thanks to technology, moms and dads now have the options to do the classes online. As an intern, I definitely need to learn about all these classes and teach the class to our clients. Forgot to mention how WIC clinic really look like. So just like any other outpatient clinic, you have a front desk. That's where you can register, that's where you can enroll. And then at the back, there are different cubicles and you'll sit face to face to your counselor. There are usually one designated breastfeeding counselor's cubicle only teaching or talking about breastfeeding, and there are another designated office. It's for our WIC manager. So the WIC manager will manage the clinic as well as accepting high-risk cases like high-risk pregnancy. So one thing I want to make it clear is that you don't have to be a dietitian to work as a WIC counselor. But you need to have a nutrition degree or become a dietitian to be a WIC manager so you can see those high-risk cases. Besides nutrition counseling and teaching classes, as an intern, we also need to learn about the administrative and management part of WIC. For example, I sat at the front desk for a week too to experience the signing in process, how to screen a patient, and how to help a patient to enroll at WIC. For the management side, I shadow the clinic manager to do schedulings for the employees, to work on evaluations of worksheets, as well as complete the quarterly site safety reports. These are the main experience for me working at WIC. Keep in mind that WIC consider an outpatient setting, so the clients will come to see you. You will need to do counselings, classes, management, and administrative work. Next, I want to share with you guys what is the difference working at WIC and other outpatient settings. So working at WIC, the population you've seen every day is very similar. You will always see pregnant women, postpartum women, infants, and children. These are probably the only population that you would see. Therefore, their conditions or health problems or the knowledge that you want to share about are very similar. At other outpatient settings, if you open your own private practice or if you work under a doctor's office, you will probably see a wider population because you might see people have all sorts of disease. The second difference that I noticed that is the duration of counseling. It's so different. The duration of a counseling session at WIC only takes you about 5 to 15 minutes, but it rarely goes to 15 minutes. However, working for other outpatient settings, a counseling sessions mainly goes from 30 minutes to an hour. Although the counseling sessions were only 15 minutes, the counselors at the WIC clinic actually sees patients all day long. Keep in mind that there are a lot of WIC participants across the nation. We had about 4 to 8 counselors per clinic, and that depending on the size of the clinic that you work at. In the US, even though WIC is all funded by the USDA, they have different agency and different agency have different clinic area. So I'm only representing the agency that I intern under. However, according to the information I gathered during the managers meeting last November, so November 19, the clinic that I interned had seen more than 2,700 patients in October 2019. There were also other clinics under our agency that seen more than 5,000 participants in October 2019. Under the agency that I interned at, we have 12 clinics locations. In October 2019, we had helped more than 44,000 participants in the 12 clinics we served. Therefore, I think WIC is an incredible program that could help so many people. It's just so amazing that it can help pregnant women, children, infants to have a better nutrition and health. Next, I want to share with you what I think of working at WIC. If you are interested in this population like pregnancy and lactation health, pediatrics, or infants, WIC is definitely a place for you. Also, if you are interested in improving public health or working under a nonprofit organization, WIC is definitely a place for you as well. However, if you do like to challenge yourself with different patients or to see more complex patients, let's say TPN or enteral feeding patients, then I think WIC does lack the variety of patients that you will see. Working at WIC is actually pretty repetitive, I would say, because you will see the similar populations and similar problems of them. However, it is also very meaningful for you to see the impact that you make on the patient. For example, you will see this pregnant lady who just beginning of her pregnancy, and then she gave birth, and then you might see the child growth. And you just will see the difference that you make on her, how to make her healthy, how to make her children healthy. I think that's meaningful. For the salary aspect, from what I know, WIC actually pay higher than an entry-level clinical dietitian. Yes, you didn't hear me wrong. Clinical nutrition usually pay less than most of the outpatient settings, including WIC. Last but not least, if you are a WIC employee, you have a lot of the benefits because it's from a government program. So I'm sure you will have all the benefits from the government, and WIC is from the union workers. So it will definitely protect a lot of your benefits as well. By the way, my next video will be about my graduations of my DI programs, and I'll share more about my thoughts throughout the whole internship. I will introduce to you what I did, what internship I went to, what is something that you should notice or you should know before you go into the internship. So if you don't want to miss it, subscribe to my channels and turn on the little bells there, then you won't miss the notifications when my new video is uploaded. Now, I want to keep the promise and show you the advice from my WIC manager.
Hello, my name is Joanna. I work for the WIC program. Wanted to let you know that when students come through, one of the things that I think is really important for each student to have is initiative and for them to be assertive. Definitely show responsibility, and a very important one is, arriving on time, good communication, and that will definitely give you a good start with your rotation. So some of the things that our internships look for are the ability of teaching a nutrition class, getting familiar with the nutrition education material that we have, also helping out with counselings. So it just depends on the type of rotation you have, but you might be co-counseling with your preceptor, so showing the ability with your nutrition knowledge. So counseling, teaching classes, assisting with administrative work, relief, also professional presentations. So those are just some of the things that you might see.
So that's about it about my video for today. I hope you definitely take away something from this video, and I'll see you next video about my DI graduations and my thoughts about my dietetic internship. I'll see you next time. Bye!